Although ecstasy can cause depressive feelings, there are some who believe the drug can also be used to treat depression. The roots of MDMA as a therapy drug go back to the late 1970s, when psychedelic pharmacist Alexander Shulgin, often dubbed the godfather of ecstasy, synthesized the compound in his garden laboratory.
I saw it as almost like an intoxicant. I could see where I could have gotten really into the knack of using it, except my search was not being pleasurably turned on. My search was finding new things.
Shulgin gave MDMA to psychologist friends, and before long, the drug was being used during sessions for couples in relationship therapy. When it was banned, this use of the drug went underground. But recently, there's been a movement to legalize MDMA in therapy. Dr. Rick Doblin is a major advocate.
We're primarily engaged in trying to develop MDMA for post-traumatic stress disorder, and then another approach is looking at MDMA for cancer patients with anxiety.
Sue Stevens first came across MDMA when her husband was diagnosed with kidney cancer.
We had a total breakdown in communication. We could not talk about anything having to do with his health at all. So if he brought up, well, I got to go to a doctor's appointment or this is going on, I would tense up and I would think, cancer, doctor's appointment, death, and my head would start spinning and I would start crying and that would have me upset and he would be upset. So it got to the point we just stopped talking about it.
A friend who had heard of the use of MDMA for relationship therapy suggested Sue and Shane try the drug. After checking it out and with guidance from an underground therapist, the couple decided to take the drug together for the first time.
We're sitting there watching movies, and about a half hour into it, we're sitting there going, wow, this is a crappy movie, what are we waiting for? And all of a sudden, phew, it all came to life. Like the drug kicked in, and he just looks at me and he's holding my hands. He's going, all right, let's talk. I know what you want to talk about. Come on, let's go.
Sue and Shane took MDMA together on 3 more occasions and were so impressed by the drug, they filmed their final session.
When you take MDMA, things don't hurt you, the words don't hurt you. You can feel them, but the pain doesn't come along with it.
The reason MDMA is such an effective drug is because it reduces the fear response to emotional threats. It's almost miraculous in a very short amount of time by the way that it strengthens people's ability to accept and integrate emotional challenges.
Had we not done that first session, we would not have been together at the time of his death. So MDMA fixed us.
After Shane's death, Sue turned to MDMA again, this time taking the drug with a trained therapist who helped her work through her grief.
Every drug has side effects, every drug has risks. And the problem is that those people that have demonized MDMA have tried to exaggerate the risks and say that there are no benefits. What really matters is how you balance the risks and benefits.
Soon, a trial will begin, testing MDMA as a way of helping Iraq and Afghanistan war veterans suffering from post-traumatic stress.
I think we're about 10 years away from MDMA as a prescription medicine.